Hello, everyone. Nice to meet you. My name is Wanjin Jun, and I'm a resident physician here at Loma University. And I want to thank each of you, and especially MOASC, for the opportunity to share this poster with all of you. Today, I present to you the case of a patient with undifferentiated pleomorphic sarcoma who demonstrated an exceptional response to neoadjuvant therapy after immune checkpoint inhibitor use. In brief, undifferentiated pleomorphic sarcoma, or UPS, is a rare subtype of soft tissue sarcomas, and it is unfortunately associated with poor prognosis due to high metastatic potential and high rates of recurrence. And while surgical resection is standard of care and can be curative, the management of patients with unresectable disease and patients with poor performance status is very challenging. A 69-year-old female presented to our institution with an enlarging left axillary mass, as you can see in figure A. The PET-CT showed a 16-centimeter left axillary mass with high FDG avidity, which was concerning for neoplasm. Very interestingly, this patient about a month prior had received a single dose of ipilimumab and nivolumab for presumed melanoma. And as you can see in figure B, there was a questionable focal HND45 positivity, which led to the diagnosis of melanoma. And when the patient came to our institution, a repeat biopsy was obtained. And in figure C, we can see the pathology slides showed diffuse sheets of malignant cells consistent with high-grade neoplasm or consistent with UPS. Unfortunately for this patient, she had a very poor performance status, an ECOG score of 4, and so she was not a candidate for surgical or systemic chemotherapy, but then she received palliative intent radiation therapy due to high symptom burden. After about 3 sessions of radiation therapy, there was a significant improvement in performance status, and the repeat CT of the mass, as you can see in figure D, showed a significant decrease in size to about 10 centimeters. Following that, the patient received neoadjuvant doxorubicin for 6 cycles, and finally underwent 4-quarter amputation with no residual viable disease. And thankfully, the patient remains in complete remission to date, which is about 38 months since the initial diagnosis of UPS. I do want to highlight to all of you timeline in figure E, which shows that in month 0, which is when she received a single dose of ipilimumab and nivolumab, and in month 1, 2, 3, the patient received 3 sessions of palliative intent radiation therapy, about 24 gray total. And in months 4 to 8, she received 6 cycles of doxorubicin, which the patient tolerated. And finally, month 11, she underwent the left 4-quarter amputation, and the pathology showed no viable disease. In early phase trials recently, immune checkpoint inhibitors have demonstrated activity in UPS. And this patient's complete response to neoadjuvant therapy raises the question as to whether initial immune checkpoint inhibitor therapy contributed to her favorable outcome by enhancing the immune response or altering the tumor microenvironment. The tumor microenvironment is a very important topic, especially in the discussion of immune checkpoint inhibitors. And authors like Kung et al. Demonstrated that after radiation therapy and chemotherapy, there were alterations in the UPS tumor microenvironment, including increased levels of PD-L1 expression and even novel PD-L1 expression in UPS tumor cells that previously did not demonstrate PD-L1 expression. Further, it was very interesting that palliative intent radiation therapy resulted in dramatic improvement of performance status, which actually led the patient to undergo definitive therapy. And results of trials involving immune checkpoint inhibitors alone or in combination with chemotherapy and or radiation therapy are very much anticipated. In the future, immune checkpoint inhibitors may play a very significant role in cases of undifferentiated pleomorphic sarcoma in various treatment settings, including those with unresectable disease and those patients with poor performance status. And further molecular studies on the tumor microenvironment may help us understand the possibilities of immune checkpoint inhibitors and perhaps priming undifferentiated pleomorphic sarcoma tumor cells to subsequent lines of therapy. Thank you all for listening.